All right, good afternoon, everybody. Hope you had a good weekend. Here with Josh and Paul. Little update on what's happened over the last week and over the last few days. The COVID summary, you see some big numbers there. I just want you to keep it in perspective. Those are 3 days worth of numbers. So remember, a positivity rate of about 1.2%. We can talk about that in a minute. Up a little bit from our norm, but still historically low. That's out of almost 50,000 tests, so we're still running at about 100,000 tests a week, which is really where we wanted to be. You may say, oh my gosh, hospitalizations, 13. So we have a total of 64 folks hospitalized for COVID-related right now. We've averaged between 50 and 70 over the summer. So I think the numbers are still trending in the right direction. And that's what this next chart tells you. You've seen this probably 100 times. It just shows you where we had our peak back there in mid-April. We started opening May 20th. You've seen that positivity rate going down and hospitalizations. Those are the key numbers that we care about. We were up at 2,000 hospitalizations back in the middle of April. And so our weekly average is about 1.1%, up a little bit. We can talk about that, but you got to remember that's 1.1% compared to, Alabama's at 14%, and Arkansas is at 21%, and North Dakota with the Sturgis Motorcycle Rally, that's at 36%. So I think we're still in a pretty good place. Keep that chart up there. I just wanted to say, as you know, I focused a lot on the risks over the course of the next 2 months, and I thought this was going to be a really key 2 months. One was as regards getting our colleges back. We've talked about that. You've probably seen, some headlines regarding what's going on at the colleges. I think it's worth remembering that we've had a grand total of 32 the infection rate at our colleges is much less than 1%. I think that's what I meant to say. Much less than 1%, really across the board. Slightly higher off campus at UConn stores. So what you see at UNC, what you see at Alabama, what you see at Notre Dame, where they had to shut down, thankfully so far with really strict testing, our universities have done, relatively well. Western Connecticut opened up for residential students again today. I think this is really important. The Cal State system, schools, colleges in California are down. Others have been shut down. Ours so far are following the protocols and making a difference. And I would say the same thing for K through 12 education, where obviously there's an awful lot of attention. We have kids or grandkids who are there. I think it's worth remembering that of all the schools that have been opened, some full-time, some part-time, about, a third are getting up to full-time. We've had 32 infections. That's 32 out of 600,000 or 700,000 students and teachers and administrators. So I know you see some headlines and numbers and, oh my gosh, there's an infection here and an infection there. It's a much lower positivity rate than we're used to seeing in the general population right now. And there's some confusion, but generally that means a class is being quarantined if there happens to be an infection. Maybe there have been 10 or 12 buildings out of all of the buildings across our whole school system. So I feel pretty good about where we've gone in the last 2+ weeks of K through 12 education. Look at that compared to, we've got a third of our kids going to school, soon to be going to school full-time K through 8. We'll get that up over 50%, we hope, over the next 2 or 3 weeks as people get more comfortable. The rest are hybrid, very, very few are just distance learning. Come on, New Haven, I think you ought to take a look. You have a very low infection rate, and these kids have a chance, ought to have an option to go to school. Obviously, nothing is mandatory. Compare that to California, which has none of their schools open. Compare that to Oregon. Compare that to New York City, which maybe is going to open up their K through 12 in the next week or two. Look at Massachusetts, which has 25% of their schools is all distance learning. no in-classroom opportunity at all. Connecticut, maybe that's 2% in those one-off situations. I think it's 500,000 of our 530,000 kids at least have the option of in-classroom education. And I think that is very positive in terms of what we're trying to accomplish. So schools and colleges, that was one of the hurdles that I saw as I thought we were sort of heading into, since it's football season, what I hope is going to be the fourth quarter of COVID. Josh says make no predictions, never when it comes to COVID. We don't know what is the fourth quarter, or we just the beginning of the first half. We're finding that out. But we do know that over the next 2 months, we're going to have a very good idea of K through 12 and college. Over the next 2 to 3 months, we're going to know how we manage through the flu season. And Deirdre has said, you know, that's October, November. You probably heard from all of our healthcare experts. They worried about a flare-up in October, November, December. And fortunately, Connecticut is almost without peer over the last decade or so in terms of the number of people that voluntarily get the flu shot. We're going to make that free. We're going to make that readily available, do everything we can to make sure we get up to 75, 80, 85% of all of our students and folks in school with a flu shot. I think you understand that flu has the same symptoms as COVID, so there could be a rush on our hospitalization system. So school, we left up, while I really wanted schools to open, we left that up to local jurisdiction, local superintendents for reasons that, you know, community-led. My same feeling is when it comes to football, where there's been an awful lot of energy there. And Deirdre Gifford, our healthcare team, you know, met with CIAC, I think it was last Friday, for a couple of hours. CIAC is the interscholastic league. They came forward with some strategies they hope would take high school football from a high-risk activity, make it a little bit safer. And I appreciate their really good faith efforts that way. You know, Deirdre and all of our healthcare folks, and also the National High School Association for Sports, you know, all have said football is high risk. So obviously, Deirdre sent a letter to CIAC. She's health commissioner. Saying, look, we strongly recommend you do this in the spring, you don't do it in the fall. That said, the final decision will be made by CIAC, probably with local input from coaches and maybe parents and superintendents, I hope, you know, very soon. You may say, oh, what's the difference? I mean, why put it off till spring? What's going to be different? I think there could be a world of difference where it's much safer. Not only are we through the risk of, you know, the colleges, we're also through the bulk of the flu season. Hopefully we'll have that 5-minute Abbott lab test. Hopefully we'll have some new therapies that are in the offing. I know some people are hopeful we're going to have them before Election Day. I think it's reasonable to assume we'll be in a much better position to prevent and stem and hold down COVID in February than we are in September. You know, that said, I understand all the concerns around the vaccines. I am proud of all the pharmaceutical companies who have said, look, CDC may be operating Operation Warp Speed. We're going to be careful. We're not going to get this released until we're absolutely safe. We can get that broadly tested before it's available to the general population. With that, I just wanted to talk about some of our enforcement as we go through. Max, the next slide. This is really following the lead of our municipalities, saying that we need a little more leverage when people are breaking the rules, when institutions and businesses are breaking the rules. CCSU had a little flare-up as related to a bar. So what we said is, look, we're going to institute a series of fines for COVID-related violations, $100 for violating the mask order, $500 for organizing an event that exceeds the size limits, you know, 25 indoors, 100 outdoors, or $250 for attending that event. That's to give our local health departments, local municipal officials a little more leverage when they go in and talk about that. What are the size limits? Josh liked the line, if you have to count, get out. Just a little turn of phrase, just like what we had on the mask. If you have to ask, don't ask. Businesses are responsible for their own employees. Individuals are responsible for their own actions. So I think this is just one more way. We're doing this in conjunction with our other neighboring states, which makes a fair amount of sense. The final thing I wanted to talk about is our travel advisory update. Max? And this is, as you know, we've always encouraged, continue to encourage, if you come from one of these high infection states, I described some of them to you before, which are very high, 15, 20+% people infected, we still strongly recommend that you self-quarantine for 14 days. That is the safest recommendation. That said, some people, it's just impossible for them to do that, so we simplified the guidance by allowing you to get a negative test result. 3 days before you get on an airplane and fly up here, or we will get you tested when you get to Connecticut. You got to quarantine until we get the test results. Just gives you a little bit more flexibility. And I think you're also going to find that over the next few days, some of those bigger states that are in red, that are on our quarantine list, will fall off that list. So we have a little more flexibility in terms of people coming in and out of the state, although it's worth being careful. I mean, compared to, say, a few weeks ago where, maybe you had a 10% positivity and, 20 or 30 per 100,000, that's been cut in half on a nationwide basis. So the trend lines are good, and that's only good if you're careful. And you can see on that same travel advisory website the list of essential workers, those that we want to make it easier for you to get in and out of, be it military or defense or, business-related, ways that we're slowly getting our state back to normal. Schools, college, travel, ways that we think we can slowly build up confidence as we get back. And this next 2 months, like I said, could be the fourth quarter of the football game. We're watching this very closely. I'd like to think by early next year we're turning the corner. Max, any questions for Paul, Josh, or myself?
Fox 61.
Good afternoon, Governor. I'm sure you've heard about this. Some people with some semi-pro football programs on the East Coast offering to help parents and families here in Connecticut set up a private club league for high school football players as an alternative to missing a high school season. I just wanted to get your reaction to that idea and ask if you have made up your mind yet as to whether you would do anything to block it if it started to happen.
No, like I said, education and sports, at the end of the day, that's going to be a local decision. In the case of sports, I think by the leagues. And I think that makes sense. But let me reiterate, this next 2 or 3 months is really important. And I do think that it's much safer if that season was put off till February.
And also for you, Governor, you have said you don't think the schools, especially at the grade school level, should close for just one case of COVID. What do you have to say to reassure skittish parents who are a little bit nervous about sending their kids back at all? Once there's a case in a school, maybe the cohort goes home for a while. What do you say to parents about that?
I say we've had a couple of weeks of pretty good activity. You see that we're erring on the side of caution. You see the principals are erring on the side of caution. And I think it's probably going to take some parents a little bit of time before they feel more comfortable with their kids getting back to school. And that's why I think you see a fair number of schools saying, let's start off on the hybrid basis, but we're planning to move to a full-time basis over the next 2 to 3 weeks if everything goes well. And if it doesn't, we know how to change course.
Mm-hmm. All right. Thank you, Governor.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. I know we've had a little bit of a tick up in terms of the positivity rate. Do you have a better sense of what might be driving that?
Matt, I'd say we were at such a very low level. You're talking about, 30 infections here or there. Deirdre has talked about some small group gatherings where maybe you can have a flare-up. You've heard a lot about Three Rivers, the nursing home. Those type of flare-ups are risky. It's worth remembering that the infection rate across all of our other nursing homes is infinitesimal. So I'm watching this. It has been, a week we're a little bit over 1%, but still puts us right near the bottom in terms of all our other states.
And just to clarify, I know we've seen quite a few schools, less than a dozen or so, that have closed temporarily to clean after having a COVID positive case. Are you saying that those schools, it's not necessary for them to close and completely clean?
What our team has said, I believe, is that, look, if there's a third grade class and there's an infection there, you track and trace. Make sure whoever was infected, whoever in that class, if they mingled with other people, then you've got a broader exposure problem. You've got to be careful. We're trying to keep these cohorts, obviously, as narrow as we can to those 24 kids who are left in the class or whatever that number may be. And that's how we can keep these schools open going forward. Some of them decided to close for a day, just to do a deep clean after every one incident. I think this will evolve over time. I do think the principals are handling it really well.
Okay, thank you.
News 12 Connecticut.
Hi, Governor. I know you said it's CIAC's decision whether to go forward with high school football, but I guess what's your message to them? I mean, what do you think the consequences are for them and for school districts if they decide to go forward without the state's blessing?
Look, Paul spoke so eloquently the other day on football is not just football. It's being part of a team. It's having a mentor. It's what it means. It brings a lot of kids to school. I understand that. I also think at this point I'm trying to do everything I can to eliminate unnecessary risks. And if you have a good alternative, it does seem to me that spring football, like New York, like Massachusetts, like Rhode Island, and a lot of other states, if they can make it work, I think we can make it work and keep faith with the kids.
So if they decide to move forward anyway, is there a plan in place either at the state or local level to protect these students, to protect coaches and anyone who might attend a game?
Well, first of all, remember, if you're a coach or you're a wide receiver and you don't feel comfortable doing this, you don't have to do it. I think you're going to find a fair number of schools, reserve the right to opt out. I know a number of the, bigger school districts have already opted out. Anything to add on that, Paul?
I would say first and foremost, it is the responsibility of the CIAC, the administrators, superintendents, teachers, principals, and adults to make sure that the student athletes are safe, whether it's in COVID time or not. So in this perfect example, in terms of the recommendations put forth the Department of Public Health, the one thing that I think is very important here is that the Department of Public Health is asking for CIAC to make sure that they're talking to their health professionals as it deals with any of these recommendations that they feel going forward to make football risk to be lowered. But at the very core, all of the individuals, all of the adults who play a role in the school ecosystem has a responsibility to ensure that the student athletes are safe, thus making sure the community is safe, because those student athletes are members of the larger community that they live in.
And just one last quick question. Senator Fasano today is asking you and the Democrats to add fixes to the police reform bill to the upcoming special session. Do you see that happening, and is there an update on when that session will happen?
First of all, on the police accountability bill, I think the legislature smartly said it doesn't go into effect until I think it's June 30th of next year. So there are time to make any clearly defined narrow fixes necessary to make sure it meets all protocols and laws out there. In terms of the timing, my understanding is that Paul is talking to legislative leaders. We're together going to come up with a very finite list of priorities and bills they want to have considered during the special session, and I'd like to think we can call it by the end of this week.
Channel 3 Eyewitness News.
Yes, Governor, just following up on the topic of schools closing for one positive case, should there be a statewide mandate on how schools should proceed with cases, or maybe like a criteria that would need to be met before an entire school could close?
Not yet, I don't think. I mean, I guess we're feeling our way a little bit, and every community has a different level of anxiety. We've known that. That's why we have a fair amount of local jurisdiction and control. And I think people are doing it right. We're trying to keep people into their cohorts so we can narrow the nature of the track and trace if there is an infection. There have been very, very few infections, much lower than in the general population. I think right now it's working okay.
And a brief follow-up to the new fines that are being implemented here. For the large gatherings, is it where we stand right now, 25 indoor and 100 outdoor?
That's correct.
And when will this start to take effect?
But tomorrow?
Yeah, we're finalizing the effective date. It'll be this week.
News 8.
Good afternoon. Governor, if I may go back to kind of lessening the restrictions in terms of the travel plan. And I know that you've said all along that the metrics and stuff would, certainly lead the way. I guess Bradley is down around 80%. How much of a balancing act is it to look at the safety aspect of it and trying to help businesses when you can, and then to come to a determination?
Yeah, that's good. Everything is a bit of a balancing act. I try and say it's, absolute metrics, but you've got to get a balance there. For me, prioritizing public health. But I look at the rest of the country today compared to it was a few weeks ago. I look at how even those states that are on the quarantine list are barely on the quarantine list. So it looked to me like this was a pretty good time to make it a little bit easier for people, assuming they, if they cannot quarantine, at least test. I think we can keep our people safe and allow a little more commerce back and forth.
One of the other points that the governor had raised a couple times as well that helped lead to this was the existing guidance had gotten quite complex and therefore confusing, and we were getting a lot of questions from people who were having a hard time understanding it and therefore potentially not complying with it. So by simplifying it accordingly, we think we'll actually get more testing of people coming into the state. Again, it's not as good as a 14-day quarantine. We would prefer people to quarantine wherever they can, but I think we'll actually get better compliance overall. The other point worth noting is that this guidance is now nearly identical to what Massachusetts has been operating under for a period of time, and their infection rates have remained at very low levels as well.
And regarding the situation with the CIAC, when were they informed that, from the state standpoint, we prefer you trying spring? When were they informed of that formally?
I think they got a letter from Deirdre today.
Received a letter today, but it was, let's just say, the conversation also happened in the room on Friday. Like I said, we had a very spirited, cordial conversation, but at the end of the conversation, it was one of the recommendations put forth by the Department of Public Health.
Thank you.
Connecticut Public Media. WTIC 1080 News.
Public radio. Okay. The nursing home response, your critics have been very consistent in suggesting that the state maybe failed these people and their families from the start. How do you respond to that?
Did you hear that? What the families in their response? Say it again,
Can you
please.
repeat the question, please?
Sure. Sorry about that. Your critics have said from the start, have suggested that the state failed the people living in nursing homes. How do you feel about that when you hear it? I'm going to get a new microphone next week.
Yeah, get a new microphone. I think I heard generally about how we could have done better in nursing homes, I think. And what I would say is, unlike a lot of other states, we hired the very best group we could, Mathematica. We said, take a look at our nursing home response. We want to learn from it. We want to make sure that we can do even better next time around. I feel good in terms of how we were very strict about not allowing people into those nursing homes. We were one of the first states to do that. As soon as we got the testing capacity, we accelerated that, and right now the infection rate at our nursing homes is lower than the general population. But there are some flare-ups, and there will be penalties to pay where people failed.
Thank you.
The Associated Press. The Hartford Courant.
Hey everyone, this is Emily Brinley from the Current. I think that somebody asked this before, but I couldn't quite hear the answer. With the new fines, when does that go into effect? And I assume that's going through an executive order?
Hi, Emily. That's correct. It'll be done via executive order. The executive order will likely come out tonight with the effective date that we're still finalizing, but it'll be this week.
Okay, and can you explain a bit about why you decided to impose those fines at this time?
Yeah, it was really in response to a request, multiple requests we've received from our municipal partners, our mayors and first selectmen, local health departments, local law enforcement. Today, under current law, if a violation of one of these executive orders around, the mask requirements or the gathering limits, the first tool that those municipal partners have is a misdemeanor, which could mean an arrest for someone. And the consequence of that was that there wasn't really much that was being done because many people viewed that as excessively harsh for failing to wear a mask if you couldn't socially distance. So they asked for this new tool, an infraction, that was a bit of a step down enforcement that could give them another set of tools in their toolkit to help ensure that people were following the requirements at the local level.
Yeah. And I just want to reemphasize what Josh stated, that this was a request and working collaboratively with our municipalities, our local health directors, our law enforcement. It wasn't an edict from up high. These were requests that they've made. We worked through it to see the best way forward, and so we thank them all for working with us as we have shown that we've done in all of the other executive orders that we have put forth.
Okay, that makes sense. And I also wanted to ask about schools not closing because of a single COVID case. Does the state have any plans to enforce that or to step in if a school does decide to close because of a single COVID case?
Like I said, right now we're leaving it up to local jurisdiction. I think they're doing a very good job, and if we think people are getting too permissive or too restrictive, maybe Deidre will reach out to them, or Miguel.
Okay, thank you.
Hearst, Connecticut Media.
Thanks, Max. Governor, I'm just reading that the violation fines, organizing events, is that the same thing as a restaurant?
My understanding of it is those that throw those, big parties, they host them. You've seen a number of flare-ups related to them, more about a month or so ago. If you're an organizer of that, you pay a penalty.
So would this cover restaurants? How about that?
No, this is for private, public or private events. So the larger events, restaurants have to operate by a specific set of industry guidelines, 50% occupancy indoors or outdoors, obviously with social distancing requirements.
Yeah, restaurants have those safe store rules. They're pretty strict.
Well, I don't know about that, but if you say so, Governor. Going back to Senator Fasano's letter, it seems like he would like to overhaul the entire police accountability bill, and he's complaining about police already retiring and departments having a hard time retaining police officers. Do you think the state would be better off without officers who want to be less accountable?
No, I think the state, look, the legislature worked on a really good bipartisan basis coming up to that, the police accountability bill. I thought that was timely. I thought it was important, especially given the circumstances in and around George Floyd. You've seen a number of not dissimilar circumstances over the course of the next, month or so. That said, it's a bill that shows respect for the police and the amazing work they're doing. If there's some technical fixes we need to make it even better, we're going to do it. We've got time to do it.
Thanks, Governor.
The Day of New London.
Hey,
Governor, I was wondering if you have had any discussions in expanding visitation in Connecticut nursing homes. Obviously, there's a lot of concern about spread in nursing homes. I've also heard a lot of concern about social isolation and some concerns about, the people who are not included in the August 27th order. Is there any conversations to include more people in that or expand visitation?
Yeah, I think there are conversations there. Obviously, the outside meetings have been really good and very positive over the last 2+ months. I've obviously heard from a lot of the nurses and families at the nursing home how important that physical contact is. The weather is getting a little chillier, so I think that is something we are revisiting as we speak.
CT News Junkie.
Thanks, Max. I wanted to know about the travel advisory. So apparently the state of Connecticut has decided to allow the state of New York to determine what states are on that travel advisory. Can you explain that decision?
I wouldn't say that. I think together we came up with the metrics that we thought made sense for the travel advisory. And we knew that working together in the tri-state region, then plus Massachusetts, gave it a lot more impact. Anything else to add on that, Paul?
Nope, that's correct.
So how were the numbers determined then? Who determines what states go on that list?
It's based on the metrics, Christine. So it's either a state that has 10 cases per 100,000 on a 7-day rolling average, or above 10% testing positivity.
Okay, so how come our information is different than Johns Hopkins University?
Well, it shouldn't be. Maybe it's off by a day or two here or there, but I think generally people are looking at the same data.
Okay. And regarding the nursing homes, is there any chance that you would get rid of the indemnity clause that was through an executive order that would allow these families to take action against these nursing homes in the future?
Yeah, Christine, that is something we're looking at.
Okay, thank you.
The Connecticut Mirror.
Thanks, Max. Josh, I just want to make sure that I clarify. Sorry to repeat this, but on the travel advisory and the new fines, under the original executive order, correct me if I'm wrong, the only folks who could opt out of the 14-day quarantine were essential workers who had a negative COVID test within 72 hours. And this modified order would say that anybody who can produce a negative COVID test within 72 hours would be able to opt out of quarantine. Is that correct?
Well, it's more complicated. So that's where it started, and then over time there were additional exceptions added. For example, if someone was unable to quarantine due to attending a funeral or taking a child to college. And so over time the exceptions had kind of built up to the point where it became very hard for people to understand. So we've significantly simplified it here, which we think will be helpful.
Okay. Governor, I wanted to ask you about when or if we make a decision about additional help for businesses. You've got all kind of metrics that you can look at when you're making decisions about schools or about these types of fines or group sizes, but it's a little more nebulous when it comes to businesses. And when you did your bridge loan program 5.5 months ago, that program, even though you doubled the amount, it maxed out within 2 days. Do you have a way to sort of take the temperature of businesses to see if they at some point this fall or winter might need some state intervention, especially given that Congress still hasn't stepped up?
Yeah, I think you hit the nail on the head. We thought by now they would have reached some sort of an agreement between the House and the Senate. Obviously, we've done $7 or $8 billion already in terms of those PPP loans. Those type of programs are probably beyond the scope of the state of Connecticut to do on its own. But we've got a couple of plans in place that we'll be rolling out over the next week or so that'll provide direct assistance to a lot of our for example, restaurants that are right now at 50% capacity. We'll see whether that changes. some of the indoor venues where they're having a problem, trying to give them a little more extra support. And I'm really hopeful that Washington, D.C. can get its act together and give us something on a temporary basis so people can count on it and we can make sure our businesses can stand on their own 2 feet.
Thank you.
Connecticut Public Media. The Waterbury Republican American.
Thank you. Governor, to use a football term, there's some football supporters out there that think you're punting on this whole issue of high school football. The CIAC won't go forward without apparently the blessing of the DPH. The DPH is not willing to give its blessing yet. You're saying it's a local decision. We've already had school superintendents say we're not going to play and go against the advice of the DPH. So could you answer those folks who think that you're copping out on this?
I think a lot of other people say, Governor, you're too heavy-handed with these executive orders. So what I'm trying to do is, look, I'm giving you the very best public health information I can. And it's not just Dr. Carter and Deirdre, it's obviously, it's Dr. Koh, it's Zeke Emanuel, it's Scott Gottlieb, it's Dr. Fauci. This issue has come up with each and every one of them. They've given their best advice that this is a high-risk sport. That said, like I said, when it came to education, this is something that I think we can leave to local jurisdiction. I think that makes sense. They know what our public health incentive is, what we've recommended. It's, bars, restaurants, there people are driving all the way across the state or going to Boston or New York. There, I thought it was really important we do that on a statewide basis and even on a regional basis. But education and local sports, I think, are more local in nature, easier for us to contain, and I'm going to leave it up to local league to make that call.
And I'll also add to that the fact that there has been clarity. The governor has stated that he prefers that this is played in the spring. Can't get any clearer than that. In addition, with the DPH related information in the letter that they provide to CIAC, it is extremely clear.
Okay, and are you guys aware of the ruling by a federal judge in Pennsylvania that the state imposed shutdown orders that required people to stay at home and place limit on public gatherings to halt the spread of COVID-19 were well-intentioned but unconstitutional? And what, if any, concerns do you have on the implications for Connecticut's orders?
Man, I hadn't heard about that. There's another 49 other states that are sort of in similar circumstances. Maybe this will slowly resolve itself over the course of the next few months, like I hope.
Anybody else heard about this? Josh, Paul?
Nope. I will check with our general counsel, Bob Clark, right after this meeting.
Okay. And what, I guess, what makes you guys think that if you have this new infraction option of fines of $100, $250, and $500 for these violations, that's going to make law enforcement any more willing to issue them?
Because it's easier to issue. A $100 fine as opposed to heavier-handed remedies is something people understand. They can take it home, and I think it's the type of thing that a public health official or law enforcement officer can implement, just like they do a variety of other fines.
And also, they ask for it. That's the easiest way to answer that. It's the beauty of collaboration.
Well, who asked for it? Did the Connecticut Conference of Municipalities, the Connecticut Council of Small Towns, on behalf of local leadership, or was it individual mayors, first selectmen, health departments, law enforcement agencies?
So we hold weekly calls with chief elected officials in the municipalities. Deidre Gifford, our public health commissioner, and her team hold weekly calls with the local health directors. Commissioner Ravella is in constant communication with local law enforcement. It's come up over and over again to the point where we felt like it was an appropriate thing to do, as Paul mentioned.
Okay, thank you very much.
All right, that's the signal. As I suggested before, I know the numbers are really good and people are saying, okay, enough. I do think this is like the fourth quarter of the game, and if we get it right, we can bring this to a successful end over the course of the next number of months. By that I mean we've been able to hold this down through, the protocols we have, what we can do in terms of vaccinations, what we can do in terms of testing, what we can do in terms of the 5-minute test. These are all things that maybe are breaking in the right direction. We ought to have a pretty good idea by early next year. So I want to, I'm not starry-eyed on this, but this is why I do urge people to maintain the discipline as we go into the flu season, and we'll have a lot better information by the end of this year. Thank you, everybody.